Hi, my name is Kayla and I'm going to tell you what I have learned from this course throughout the semester. First of all, marriage and companionship, especially in the elderly, is very beneficial. Those who are married live longer than those who are widowed or divorced. There is an increase in widows versus widowers because women live longer than men, and they also tend to marry older men. There are 8.9 million widows compared to only 2.1 million widowers. Fewer men live with their families because they are usually married versus women who are more likely to be widowed. Falls are not a normal part of aging and are preventable. There is, however, an increased risk of falls with age, and fear of falling can keep older adults from leading independent lives. Falls are the leading cause of hospitalizations and injury. Falls are also the primary cause of accidental deaths in persons 65 and older. While most people believe falls occur in the bathroom, the greatest number of in-home falls, 30%, occur in the living areas, compared to only 6% of falls occurring in the bathroom. The most common home fall hazards include slippery surfaces, poor lighting, stairs, footwear, spills on the floor, and items in the walkway. Most elderly take around 6 to 8 medications, but some elderly take even more. With this many medications, there is bound to be adverse drug effects. When the elderly reach 10 or more medications, there is almost a 100% chance of adverse drug reactions. The most common adverse drug reactions in the elderly include confusion, falls, renal dysfunction, poor vision, hearing loss, and memory loss. It is important for the elderly to have medication adherence. Non-adherence accounts for 33% of hospitalizations and 25% of nursing home admissions. Examples of non-adherence include taking outdated meds, taking someone else's meds, stopping your meds when you start to feel better, not storing your meds correctly, etc. There are also cultural, social, and economic factors that affect adherence, such as low health literacy, language barriers, and differing beliefs. Cost is the number one reason why Americans age 50 and older do not fill a prescription medication. I learned from Dr. F's presentation that dementia is not a disease. It is a set of signs that result from brain malfunctions and declining mental capacities related to aging. Dementia typically affects cognitive abilities such as speech, memory, and mood. The most common form of dementia in the U.S. is Alzheimer's disease. More than 5 million people are affected by Alzheimer's disease. With increased age comes increased risk of Alzheimer's. Symptoms of Alzheimer's includes gradual memory loss, inability to comprehend, depression, insomnia, confusion, and disorientation in ordinary surroundings. The physical environment in which elderly patients with Alzheimer's disease live is critical to helping them. If the environment around them is overwhelming, they will become confused, anxious, disoriented, or even fearful. Environments that are stimulating can influence patients in a significant way. Home-like spaces should be created to remind patients of their own home. Color contrast is important to avoid confusion. Simple floor and wall covering patterns are essential. Choose non-slip, softer floors such as carpet, linoleum, rubber, or cork, and avoid hard, slippery surfaces such as tile, granite, marble, or highly polished wood. Flooring with a lot of visual textures only make those with Alzheimer's anxious and disoriented. The picture of the floor I have here is a big no-no. Wood flooring with that pattern would make someone with Alzheimer's very confused, anxious, and fearful, and may look like something completely different to them. Access to nature provides many health benefits for the elderly with any type of disease. I also learned many things from the Hmong and healthcare presentation. Wisconsin has the third highest Hmong population with just over 50,000 Hmong living in the state. The Hmong believe that the spirit can leave the body and can do so through falling, being scared, or sleeping, where the spirit can wander off and the devil can capture it. A shaman, who is the master of the spirits, can perform a ceremony to get the spirit back and heal the person. Major health decisions must be made with all close family members and clan leaders. It is important to use a trained medical interpreter instead of children or family members because information can be lost since they do not like to talk about health problems. Adult daycare was something I was unaware of. This service provides care to those who still want to live in the community and be as independent as possible. Elders can interact, socialize, and get help with their ADLs here. There are no health professionals on staff, and there is a social emphasis rather than a medical emphasis. Additional services such as meals or snacks, exercise, music, crafts, showering assistance, foot care, and transportation are available for an additional fee. I also learned the difference between the two types of assisted living, CBRFs and RCACs. Community-based residential facilities provide 24/7 staffing for the residents and assist with ADLs. Memory care units for patients with dementia, for example, are available. Residential care apartment complexes are apartment-style living for more independent elderly individuals. There is no help with meds or bathing, and medical staff only checks up once per day. RCACs provide a social community for residents. What we think of as a nursing home is called a skilled nursing facility, or SNF. SNFs provide long-term care, advanced stage dementia care, hospice care, and short-term or subacute rehab. Additional services such as food services, laundry, religious services, beauty and barber services, podiatry, optometry, x-ray, dental, audiology, and lab are also available. How will I apply what I have learned to my future career as a health professional? As a future physical therapist, I will be working with many patients, especially elderly patients. I will work with them to strengthen muscles and improve their range of motion to be able to get around easier and to prevent unnecessary falls and injuries. I will also see many elderly patients with joint replacements who require strengthening. As a health professional, I will be dealing with patients of many different cultures, and it is important that I understand what their beliefs about healthcare are, and also to understand how to effectively communicate with them, whether it would be through the use of a trained medical interpreter, or through pictures and drawings, or through physically showing them how to perform these exercises themselves. I believe this course was very useful in preparing me to provide care to future elderly patients. Thank you.